On this Wednesday night, a new blood test for COVID-19 approved in Canada. The answers it can and cannot provide.
The mere presence of antibodies alone does not mean we are protected.
Plus, a frank assessment of what the world is facing.
This virus may never go away.
Europe's goal to save summer vacations safely.
People need, of course, to be able to travel between European countries.
New learning curve. Canada's post-secondary schools gear up for a different fall semester. And you've got to be kidding.
Go, go, go.
The goats who hope the grass might be greener on the other side.
Global National with Donna Friesen.
Good evening and thanks for joining us. As we long for an end to the stranglehold this virus has on the world, there's a sobering reality check tonight on how much we still don't know about COVID-19. The World Health Organization says it's possible it could be years before it's under control, and we may have to learn to live with it. More on that in just a moment. The best case scenario is a safe, effective vaccine that's made available to everyone. That doesn't exist yet. But Health Canada did announce other progress today. It has approved the first serological test in Canada, a test for antibodies to determine who has been exposed to COVID-19 and who could possibly be immune.
This is a critical step for the work of the COVID-19 Immunity Task Force. These tests will help us better understand immunity against the virus and how it spreads, so we can keep Canadians safe and healthy.
This is not the swab test to find out if you have an active case of COVID-19. It's a blood test to detect antibodies, which would reveal if you've been infected in the past, perhaps without any symptoms. Here's why that's important. There are now more than 72,000 confirmed cases of COVID-19 in Canada. Those account for the people tested. It doesn't account for those who had the virus but showed few or no symptoms and were never tested. So we still don't know how prevalent the virus is in society, nor do we know how many people might be immune to it. Without that, it's difficult to know where restrictions can be safely lifted. There's still a great deal we don't know. Heather Yourex-West explains how this newly approved test works and the questions it might help answer.
The company behind the first COVID-19 serology test approved for use in Canada is from one of the first countries to be hit hard by COVID-19.
The fact that Italy, unfortunately, have over 30,000 dead people from this really devastating pandemic gave us the opportunity to very quickly have clinical samples and develop a very good assay.
The blood test was approved for use in Europe and the US at the end of April. The company says it's now shipping kits worldwide. It plans to produce 5 million this month, 10 million in June.
I can tell you that 10 million per month, which sounds like a huge number, it's a fraction of what countries are looking for.
Having an effective serological test is vital, especially as businesses start to look at reopening, because knowing who has already had this virus could help public health officials determine who may be immune to future infections.
Problem is, we still don't know enough about this virus to be sure.
The mere presence of antibodies alone does not mean we are protected, and we shouldn't be using this as a green light to say that we are fully immune to the virus.
We have to study the immunology, the immune response to the virus at the same time. And then we can interpret these tests as to what they mean for an individual.
For now, Dr. Theresa Tam sees the new test as a research tool, a way to learn more about how the virus behaves. It will also be used to determine how many Canadians may have been infected during this first wave.
The approach that we're taking in Canada is to use these tests, first of all, in the context of population studies.
This is a fantastic tool. This is going to provide a lot of insight, but this is not, at this point, a gateway to know who's fully protected and safe to go back to work with no other precautions.
So while something like an immunity passport may not be here yet, it is getting closer. And the approval of this test is an important step. Heather Yourex-West, Global News, Calgary.
Now to the hard reality check from the World Health Organization today. Dr. Mike Ryan, an epidemiologist and head of the emergencies program, says COVID-19 may be with us for years. There is still so much we don't understand about the virus, and he says no one can make promises or give firm dates on when it will no longer be public enemy number one.
And I think it's important to put this on the table. This virus may become just another endemic virus in our communities, and this virus may never go away. HIV has not gone away, but we've come to terms with the virus, and we have found the therapies and we've found the prevention methods. And I'm not comparing the two diseases, but I think it is important that we're realistic. And I don't think anyone can predict when or if this disease will disappear. We do have one great hope. If we do find a highly effective vaccine that we can distribute to everyone who needs it in the world.
One of the many uncertainties about the virus is the impact on children. Few kids are getting sick, but some are getting very sick with a mysterious syndrome believed to be linked to COVID-19. Ontario's health ministry has revised its definition of COVID-19 now to include what's referred to as a multi-system inflammatory vasculitis, a condition similar to Kawasaki syndrome. A direct connection between the coronavirus and this syndrome has not been confirmed. Doctors and patients are urged to monitor kids for symptoms including persistent fever, rash, abdominal pain, vomiting, and diarrhea. There have been reports of deaths in children associated with inflammatory illnesses in other countries, none here in Canada. A nurse who worked at a long-term care home in Ontario has become that province's first registered nurse to die of COVID-19. Brian Beattie worked at Kensington Village in London, Ontario. He'd been off work getting treatment when he died. 7 other staff members at the home have also tested positive. Beattie is being remembered as a dedicated employee who loved his job and considered his colleagues and the residents of the home his other family. 5 residents at the home have died of COVID-19, and there are still 3 active cases. The Ontario government now has the power to step in if a long-term care home is struggling to cope with an outbreak. The province has issued a new emergency order that would allow it to replace the management of facilities that have a high number of infections or deaths, or if there's a staffing shortage.
It's just a tool in our toolbox to use if we need it, so that we can move in rapidly. If there's some care homes that continue to have problems and are resistant to having any assistance, then we know that we will be able to get in there quickly because we want to save lives.
Ontario is also redeploying education support workers who aren't engaged in distance learning right now to help out in care homes and hospitals. There are 180 outbreaks at long-term care homes in Ontario and more than 4,300 confirmed cases. Ontario's premier made it clear again today he doesn't think the time is right to reopen the border between Canada and the U.S. Doug Ford says it's just too risky. He and the premiers of Quebec and BC told the Prime Minister this week they don't want travel restrictions eased when the Canada-U.S. border deal expires May 21st. Negotiations are underway to extend that restriction. The border has been closed to all non-essential travel since March 21st, and Canada is trying to keep it that way until at least June 21st.
Conversations are ongoing, are constructive or productive. I won't make any announcements today, but I can say that things are going well, and we're confident about being able to continue to keep Canadians safe.
Europe is also looking at loosening border restrictions in hopes of salvaging part of summer tourist season. A little later, we'll look at what's being planned and is a European vacation realistic? In the race for a vaccine, one company says the U.S. will get a leg up. The head of French pharmaceutical giant Sanofi says the U.S. will likely be the first to get the vaccine if that company successfully develops one. The CEO told Bloomberg News that's because the U.S. government was first in line to fund Sanofi's vaccine research. It partnered with UK company GlaxoSmithKline and hopes to start human clinical trials this fall. It's one of about 100 vaccine candidates in the preclinical phase. 8 others have begun human clinical trials. If one of them works, there's a push by some countries for equitable access for all, but it's unlikely every country will get it at the same time. In the U.S., there's a battle between the politicians and the scientists over how to tackle COVID-19. Our Washington Bureau Chief Jackson Proskow joins us. Late today, Jackson, President Trump spoke to reporters and he contradicted the country's top doctor. What did he say?
Hi, Donna. This battle between science and politics really has become a feature of the White House response. Some Trump administration officials are now reportedly casting doubts on the official death toll numbers provided by the CDC, believing they're too high. And you're right. A short time ago, the president disparaged his own top infectious disease expert, Dr. Anthony Fauci. Yesterday, Fauci testified that it may be unwise to send children back to the school in the fall without a vaccine because there's so much about this disease and its impact on young people that remains unknown. But the president is firing back. He himself, of course, is not a doctor. He believes this disease, though, only impacts older people. And a short time ago, he lambasted Fauci's testimony.
I was surprised by his answer, actually, because, it's just, to me, it's not an acceptable answer.
Jackson, without a vaccine, which we don't have, testing is one part of the way to contain outbreaks of COVID-19. At least 2 staff members at the White House have tested positive now. The vice president and the president are both being tested every day. But there's concern about the reliability of those tests.
That's right. Specifically, the reliability of a 15-minute rapid test that's really been promoted by the White House and used by the White House on the people closest to the president and vice president. A new study from NYU finds that it's missing between 30 and 50% of positive cases. That's a huge problem, especially considering the circumstances it's being used under. We should point out this study is preliminary, has not been peer-reviewed, and essentially calls into question the need for more research. Donna, like so much to do with this virus, there are a lot of unknowns and a lot of concerns that the fuller picture of the virus and its spread is still being missed.
All right, Jackson Proskow in Washington, thanks. The FBI says it is investigating hackers affiliated with China who are targeting researchers working on COVID-19 treatments. It says healthcare, pharmaceutical, and research organizations are considered prime targets and says they should take all necessary action to protect their systems from being compromised. The FBI recommends monitoring for unauthorized access and warns that media attention linking an organization with COVID-19 related research will lead to increased interest in cyber activity. President Trump's former campaign manager, Paul Manafort, has been released early from prison because of the risk of COVID-19 in jail. Manafort will serve the remainder of his 7.5-year sentence from home. The 71-year-old was convicted on a number of crimes, including tax fraud and foreign lobbying violations. Manafort is one of more than 2,500 federal prisoners in the U.S. who have been released because of the pandemic and will serve their time under home confinement. Canadian big oil blacklisted. Coming up, why it's being shut out of the world's largest wealth fund. With the approach of summer, many people are wondering what their holidays will look like. The tourism industry everywhere has been hit hard. Today, the European Commission set out some guidelines for how businesses in Europe might try to salvage the summer travel season. Crystal Goomansingh reports.
A sun-drenched beach vacation sounds fabulous, but getaways seem far off in a world where garden centers are just opening.
This is our bread and butter time of year. This is when we get excited.
This is also bread and butter time for the tourism sector. It's unlikely Canadians will be taking in the sights from the London Eye or any other popular spot. Instead, the idea is to target the roughly 400 million people within Europe.
Hotels, restaurants, beaches, other tourist sites, they need to be run in a way that minimizes the risk of passing on the coronavirus.
European Union member states are encouraged to re-establish free movement, and guidance is being offered to the tourism sector. Resorts, for example, are instructed to start preparing locations where groups would gather so they can be physically distanced, to allow for digital bookings of pool areas and dining locations, and to get workers protective equipment. The recommendations come weeks after Greece, for example, said it wanted to open to Europeans. Everyone is waiting to see if the 2020 season can be salvaged.
This is $1 million question. Of course, this depends on all the countries and how they fare with this crisis, but we're aiming to open up sometime in July.
Many cities hit hardest by the virus rely on tourism and have been struggling financially even before the pandemic. And now most travel will be across land borders rather than flying into locations farther from home.
At the moment, when you're asking people to travel, you're asking people to counter fear. And fears and risks are much more manageable the closer to home they are.
The industry hopes it'll be a short transition from picking up crimson flowers to taking in a golden sky. Crystal Goomansingh, Global News, London.
There's some confusion in the UK over government plans to ease lockdown measures there. After 7 weeks, people are being allowed more freedom to get outside, and they've been encouraged to go to work if they can't work from home, but also told to avoid public transportation. That's not easy in a city like London. The government also advises to wear face coverings on transit, but that's not mandatory. The plan outlined on Monday is a phased-in approach to ending the lockdown restrictions. Critics say it's confusing and potentially dangerous. There's another major blow to Canada's struggling oil and gas sector. Norway's sovereign wealth fund, the world's largest, announced today it will stop investing in 4 Canadian companies. Norge Bank says it will no longer invest in Imperial Oil, Suncor, Syncrude, and Canadian Natural Resources because they produce what it calls unacceptable levels of greenhouse gas emissions. It's the first time emissions have been stated as the reason for excluding companies on ethical grounds. Prime Minister Justin Trudeau says the news is part of a continuing shift in global attitudes, and oil companies will have to adjust.
Many companies in the energy sector have understood that the investment climate is shifting, and there is a need for clear leadership and clear targets to reach on fighting climate change to draw on global capital.
Since the year 2000, the companies operating in Canada's oil sands have reduced their per-barrel emissions by 28%, but production has increased and overall greenhouse gas emissions have continued to rise. Canada is one of the biggest emitters per capita of greenhouse gases.
Making sure that people...
The Obama's video bomb, a virtual town hall, gets some surprise guests.
You're watching Global National.
Brazil is now the epicenter of the COVID-19 crisis in Latin America, and it has recorded its deadliest day. 881 people are known to have died from the virus in Brazil on Tuesday, bringing the country's total death toll to over 12,000. Brazil is now the 6th worst affected country in the world. But it is only testing people who end up in the hospital, and experts say the scale of the outbreak there is likely much worse. State and city governments are proceeding with mandatory lockdowns against the will of Brazil's president, who has said that job losses are more damaging than the virus. Southern Africa's tiny mountain kingdom of Lesotho has confirmed its first case of COVID-19. It is the last of Africa's 54 countries to report the disease. The nation of 2 million is surrounded by South Africa, which has the highest number of confirmed cases on the continent. With limited testing in many African countries, there are concerns the number of COVID-19 cases could actually be much higher. Post-secondary education in the pandemic. Next, what classes could look like this fall.
When we heard that there was going to be a civic town hall going on, Michelle and I decided we were going to crash.
As former U.S. President Barack Obama and his wife zooming into a high school civics class, they surprised these students in Chicago, encouraging them to stay engaged and reminding them the power they have and the role they play in the future of the country and in democracy. It is an uncertain time for Canadian university students, too. COVID-19 has forced many post-secondary schools to change the way they will be offering classes in the fall. Some universities have already decided they'll move entirely online, offering no campus experience at all. As Michael Couteur explains, that's prompting some students to reconsider their plans for September.
These days, Charles Wolfe spends more time doing yard work than school work. The second-year McGill student is back home in Ottawa and isn't sure he wants to do his online semester from here.
I can't really focus at home. I went to boarding school before, so coming home is kind of like, it's always a holiday. So I don't do work here, so it's so hard to do work here. And it's not like I can go to the U Ottawa library and do work there, because that's also closed.
McGill is one of several post-secondary institutions moving most fall courses to remote platforms. The University of British Columbia is moving larger classes into virtual classrooms, with a select number being offered in person, but still respecting physical distancing. The Western University is also leaning towards a mixed model. President Alan Shepard admits striking the right balance hasn't been easy.
There's no pandemic playbook for universities. It's very complicated. It's huge. It's hundreds and probably thousands of logistical decisions. Very, very complicated.
And students feel the struggle too.
I can't go in and talk to a person, ask them questions personally. It's all over video. And you can't show your laptop to a professor on video if the laptop is the video.
Now imagine if you're in medicine or another hands-on program. Replacing that practical experience is practically impossible. Cost is another consideration, with many students saying tuition hasn't decreased. Now, according to a recent survey for the Canadian Association of University Teachers and the Canadian Federation of Students, 30% of returning and new students might change their plans about enrolling at a post-secondary institution this fall. That includes Amina Shakil, who is supposed to start university in a few months.
I had it all planned out, like the school I wanted to go to, the program, the residence I was applying for. And then when I found out that most schools were going to be online, it kind of just threw off my plan.
And with so much uncertainty, so many students are unsure of where they'll be in just 3 months. Michael Couteur, Global News, Ottawa.
And that is Global National for this Wednesday. I'm Donna Friesen. You know that saying, the grass is always greener? Well, these goats tried to prove it. They broke through their fence and made a run for it through a San Jose, California neighborhood. They weren't kidding around. Some stopped for a snack on some local delicacies before they were wrangled back to their pen. Thanks for watching. Take care of yourselves. Bye-bye.